Hello, thank you for joining us again today. As usual, I'll start with giving you the national COVID statistics for Scotland. I can confirm that an additional 49 positive cases were confirmed yesterday, which represents 1% of people who were newly tested yesterday, and that takes the total number of cases now to 19,407. A full health board breakdown will be available later, but my provisional information suggests that 7 of those 49 new cases are in the Grampian Health Board area, 12 are in Greater Glasgow and Clyde, 6 in Lanarkshire and 16 in Tayside. And we are dealing with known clusters in each of these health board areas, and I'll come back to those shortly. I can also confirm that a total of 254 patients are currently in hospital with confirmed COVID, which is 6 more than the figure I reported yesterday, and 3 people are in intensive care, which is the same as yesterday. I'm also pleased to report again that in the past 24 hours, no deaths were registered of patients who had first tested positive over the previous 28 days, and the number of deaths under that measurement remains 2,491. However, we should remember that the weekly National Records of Scotland figures, which include confirmed and presumed COVID deaths, showed last week that 5 people had died in the preceding 7 days who were either presumed to have had COVID or whose test was more than 28 days prior to death occurring. This week's more comprehensive figure will be published by an NRS tomorrow. And that, of course, is a stark reminder of the impact of this virus. It is still potentially very dangerous. And of course, my condolences again go to everybody who has suffered loss. And as always, I want to thank everyone working hard still to help our country through this pandemic in whatever capacity you are doing so. You have our appreciation. Now, I'm hoping that circumstances permitting, we might shortly move to have these updates slightly less frequently, perhaps 3 days a week rather than 5. However, I've concluded that it is important this week that I give regular updates on the variety of different clusters and outbreaks that are currently being tackled across the country. Let me start firstly with Aberdeen. Given that Aberdeen and indeed the Grampian area more generally has been responsible for a very significant proportion of all new cases that we have seen in recent weeks. I mentioned earlier that 7 of today's 49 new cases were in the Grampian area, and I can report today that according to the latest figures we have, a total of 386 cases have now been identified in Grampian since the 26th of July. 220 of these are associated with the cluster linked to Aberdeen pubs, and 1,125 contacts have now been identified from those 220 cases. I can confirm today that 13 cases which had previously been identified but not allocated to the cluster have now, following further investigation, been added because they are considered to be associated with that cluster. Now, the slightly more positive news is that in recent days we have seen a decline in new cases across the Grampian area. 10 days ago, for example, we reported 39 new cases in one day. Today, as you've just heard, the figure we're reporting is 7. And the 7-day average for cases has also fallen. So that suggests that the restrictions that were put in place 2 weeks ago are having an impact, as of course are the efforts of our health protection teams. However, it is worth highlighting that over the past week, new cases in Grampian are still higher than in other parts of the country. And we will have to take that fact into account when we announce tomorrow whether or not there will be any change to the restrictions currently in place in Aberdeen. The situation there does appear to be improving, but it's important to stress that we can't yet say that that outbreak is completely over. I also mentioned yesterday a cluster in Cooperangus, which is linked to a Two Sisters food processing plant. So far, I can report that this outbreak has 9 confirmed cases associated with it, but I will be very surprised, albeit pleasantly, if we don't see that number rise in the days ahead. 7 of the cases identified so far are employees of the factory and 2 are people in the wider community, and contact tracing is ongoing for all of these cases. The factory, which employs approximately 900 people in total, so it's a big workplace, closed down yesterday, and a mobile testing unit is due on site today so that the whole workforce can be tested. Now, this is a complex and potentially significant cluster. In addition to the overriding public health concern relating to the outbreak, the closure of the plant potentially, of course, has an economic impact. And we also need to consider possible animal welfare issues as well. The animals which would have been sent to the factory in the next few days can't currently be sent there. So for all of these reasons, we are monitoring all aspects of this situation very carefully and closely, and we will provide further information in due course as and when it becomes available. There are also some cases and clusters that have been identified in the last couple of days involving school pupils. For example, there are individual cases involving school students who go to primary schools in Blairgowrie, Perth and Paisley. The health protection teams are dealing with these cases, and they have written to parents and carers of the affected children's classmates to advise them, where necessary, that their own children should be isolating. I also mentioned yesterday community clusters in Lanarkshire and North East Glasgow, which include secondary school students and which appear to be linked to each other. Now, it's really important to stress that these are considered at this stage to be community clusters with an impact on schools rather than school-based clusters, and that is an important distinction. It is not thought that the virus has transmitted within the schools. In Lanarkshire, the number of confirmed cases is 8, and that includes 5 pupils from 3 different schools. The risk of infection, though, at all 3 schools is considered to be low. The cluster in Baillieston, North East Glasgow, currently has 14 identified cases, some of which are students at one school, and contact tracing is taking place for this cluster. In addition, and this is of course relevant for both of those outbreaks, there are mobile testing units at the Time Capsule car park in Coatbridge and at Ravenscraig, in addition to the testing centre at Glasgow Airport. And let me repeat a point I made earlier, because I think it's really important for people to understand this. These are community-based clusters, and there does appear to be a link with indoor social events. And the evidence we have at this stage seems to suggest, perhaps not surprisingly, given how infectious we know COVID is, that if the virus is present at, say, a house party, everyone attending the party is at considerable risk of infection. And then, of course, the risk is that they then spread the infection more widely. And all of that underlines the vital importance right now of abiding by the restrictions on household gatherings. If I can remind you what those are, no more than 8 people from a maximum of 3 different households should be gathering together indoors, and 2-metre distancing should be maintained between people from different households. These rules are not easy, I really do understand that, but not sticking to them is presenting perhaps one of our biggest risks of outbreaks occurring at this time. So I can't stress enough how important it is that we all do abide by and comply with these rules. Now, for all of the outbreaks I've mentioned, Test and Protect teams are working hard to identify individuals who need to self-isolate and get tested. But as always, anybody who has symptoms, whether in these areas or anywhere else across Scotland, should book a test immediately. The symptoms are a new cough, a high temperature, or a loss of or change in your sense of taste or smell. Tests can be booked through the NHS Inform website, and I would appeal to you again, don't hesitate, don't delay, don't wait even a few hours to see if you feel better. If you experience any of these symptoms, time is of the essence. Book a test as quickly as you possibly can. Now, before I conclude and move to questions, and the Chief Medical Officer is with me today who will assist me in answering the questions, I just want to come back to the issue of schools and say a final few words. Firstly, to stress again that all of the cases we've seen so far which have involved school students suggest that transmission has taken place outside of the schools, not in the schools. And that emphasises again the importance of keeping transmission rates as low as possible in the community, continuing to do everything we can to drive these transmission rates down as close to elimination levels as we can. That's good for our overall health and well-being and the overall fight against this virus, but it is also the action that will allow us to keep schools safely open. And let's not forget the importance of that objective. It is overwhelmingly in the best interests of young people, particularly after 4 or 5 months when they have been out of school, to be in full-time education. The harms to them of losing out on that are considerable. But we will, I think, inevitably see more cases which involve school students in the weeks and months ahead. And in those cases, as has happened in the ones I've mentioned today, contact tracers will identify if other students or staff at schools need to isolate and will let them and their parents know. More generally, the Test and Protect system so far has worked well for each of the outbreaks that we faced to date. And for every cluster, incident management teams in the local area are considering the latest evidence and assessing what further follow-up actions need to take place. And I want once again to thank everybody involved in these efforts. So when I give updates like today's, providing details of cases and clusters in different parts of the country, and particularly when some of those cases involve schools, I don't do that to alarm you. Partly I do it to try to reassure that the appropriate steps are being taken and the appropriate interventions are in place. But though I don't want to alarm anybody, I do want people to take notice. In fact, I need people to take notice. These clusters show us that this virus continues to pose a serious risk. It is present in our communities, and that's why I keep saying, wherever you are, assume it is right next to you and capable, if you don't do the right things, of being transmitted to you and perhaps from you to somebody else. We know, and the evidence coming from recent clusters is underlining this point, this is a highly infectious virus, and once it takes hold, it can spread rapidly, and the effort that is needed then through our Test and Protect teams to stop it spreading is considerable. And remember, Test and Protect is our second line of defence. We are all the first line of defence. So for all of these reasons, the Scottish Government may well again take a fairly cautious approach on Thursday when I will announce in the Scottish Parliament the outcome of a review of the Phase 3 lockdown restrictions. But for all of us, these clusters should remind us of the need to be ultra careful right now. They demonstrate how quickly and easily COVID spreads, particularly in indoor environments, which is why I ask people to be particularly careful when it comes to socialising indoors. And remember that the limits I mentioned earlier, a maximum of 8 people from no more than 3 different households, these limits apply to groups of people in pubs or restaurants together, just as they apply in people's homes. And finally, before we move to questions, all of us must continue not just to remember facts, but in everything we do, abide by the rules that are encapsulated in that facts campaign. These are the 5 basic rules that will help all of us contribute to stopping this virus spreading and getting out of control. So those 5 rules are face coverings in enclosed spaces, avoid crowded places indoors or outdoors, clean your hands regularly and remember to clean hard surfaces that you might be touching. 2 metre distancing remains the overall rule, even perhaps especially if you are mixing with other households indoors in your own home or elsewhere. And lastly, self-isolate and book a test if you have any of the symptoms of COVID that I mentioned earlier, a cough, a temperature or a loss of or change in your sense of taste or smell. If we all do these things, we undoubtedly will continue to see clusters and outbreaks, but all of that will help us keep these contained and stop this virus taking a greater grip of us in terms of wider community transmission. So my thanks again to everybody for listening today and for continuing to do the right thing. And please, my usual plea at the end is please spread this message to as many people as you can so that as many people as possible are following all of this vital health advice. Thank you very much. I'm going to move straight to questions now that Gregor and I will do our best to address. And first today is Jamie McIver from BBC Scotland.
Good afternoon, First Minister. This question is about the rights of parents if a school pupil who's a close contact of someone with the virus is asked to self-isolate. For the working parents of younger children, there may be enormous challenges here involving childcare. First Minister, what should working parents do? And crucially, what should their employers do?
We've given very clear messages around all of this before, and we will, I should say, before I re-articulate these messages, we will always consider on an ongoing basis whether we have to strengthen the guidance or indeed go further than that and have regulations mandating actions and behaviours in certain cases. First thing I would say is we want schools to be open, and we want children and young people to be at school, and we want parents to be confident and assured about sending their children to school. And that is why my main message to everybody is do everything that we're asking in order to keep community transmission low. The biggest risk to schools are outbreaks that start outside schools and then find their way into schools. So far, none of what I've reported today is transmission within schools. So community transmission remains really important. Secondly, if you are asked as a parent to keep your child off school, please do that. That obviously is when you're contacted by Test and Protect saying that your child may have been a close contact of somebody with the virus. But also, if your child one morning has symptoms that could be COVID or gives you any concern, make sure that you don't send your child to school and do all of the appropriate things to get tested. And I know that is difficult for parents, particularly working parents, particularly after 5 months of having to homeschool and balance work, childcare responsibilities. Employers, we are asking to be understanding and considerate and to enable and empower any member of staff that themselves or who has a child that needs to self-isolate to do what is asked of them. And that is the bit that we will need to continue to work with employers on and to continue to monitor to see whether there is further action we need to take. But I can't stress enough in any aspect of this, this is about collective action. We all have a part to play, and that includes employers who I know are having a really tough time as well right now, as is the economy overall. But the route to economic recovery and having businesses open and staying open is all of us doing what is required of us to keep this virus under control. Ross Govans from STV.
Afternoon, First Minister. We've seen issues with social distancing, with senior pupils and with parents outside schools. Could the wider use of face masks be a possible mitigating factor in this? And certainly for parents who are involved in the drop-off and pick-up of younger children.
So let me say two things there. Gregor may want to come in on face masks and the importance of doing everything we can to limit transmission. I've seen myself on social media in the last 24 hours some pictures of scenes inside or outside schools that look as if they are too crowded, and where we are seeing any of that, steps will be taken to contact the relevant directors of education to make sure that schools are being supported to comply with the guidance. We keep the issue of face coverings under ongoing review, and that applies in terms of the guidance in schools as it does more generally. Obviously, young people who are outside of school and or on public transport or in shops at lunchtime or any other times, the requirement is there to wear face coverings. We have tried in the guidance that has been informed by scientific advice to make sure we have robust mitigations in place, but also balancing that with giving young people as normal a schooling experience as possible. And these are not easy judgments to get right, but we will continue to consider whether, particularly for older pupils in schools, more use of face coverings is appropriate. Where any young person or staff member wants to wear a face covering in school, of course, they should be supported to do that.
The Scientific Advisory Group on Education and Children reviewed a whole series of evidence in relation to face coverings and their use in both children of all ages and younger people. And it's very clear that the evidence remains divided on this. That said, I think it's really important that we continue to consider all the available evidence to this. One of the considerations, of course, in all this, as the First Minister has already outlined, is what's the prevailing prevalence of the disease in the surrounding communities, because what happens in the schools will be very much a reflection on how much disease activity there is in the surrounding communities themselves. Where there is very low prevalence, as is the case in certainly in the majority of Scotland, the use of face coverings really adds very, very little in terms of protection, and it's not a proportionate response in terms of the potential harms that it causes both to individuals and to their schooling and education experience as well. That was the view of the education group. However, the education group also made it very, very clear that they wanted to keep that under review, and they would continue to consider fresh evidence as it came forward, but also continue to consider the changing prevalence in Scotland as well and take all those factors into account.
Thanks. Kieran Jenkins from Channel 4.
Internationally, Scotland does appear to be something of an outlier in terms of opening schools with fewer restrictions. And you were suggesting that so far the virus seems to have been transmitted outside rather than inside schools. But you'll also be aware that one of the biggest global studies so far finds that older children transmit the virus just as well as adults. So surely you expect and are preparing for transmission to occur within schools.
I certainly wouldn't stand here and complacently rule that out, Kieran. We are trying to prepare for and expect all possible eventualities when dealing with this virus, and we don't, I hope, whether people agree or disagree with different decisions we've taken, there is no sense of being complacent in the face of a highly infectious virus. Can I just say a couple of things? The scientific advisory group, the subgroup of our advisory group that advises on children and young people's issues, they have and will continue to take account of international studies, and some have been mentioned in these briefings over recent weeks, one from Israel, for example, which they have looked at and will continue as if and when evidence emerges to look at that. What we also know, and Jason Leach was with me yesterday and made this point probably better than I'm about to make it, is we also know that there are no absolutes in terms of age groups that do and don't transmit the virus. It's a gradation as you get older. So the older somebody gets, the more they're likely to transmit it. But we do also know, as of now, and again, this is something we're not complacent about, because I've talked in recent days of the age profile of cases changing slightly, but to date, of the 19,000 or so cases we've had in Scotland, something like 1% have been, I think slightly under 1%, have been in the under 15 age group, around 2% in the under 20 age group. So we do know that the risks of transmission are lower. There's no absolute cut-off point in younger people, and also the evidence so far suggests that the severity of the disease is milder. We keep all of this under control, but the final point I want to make, Gregor might want to add something too, is that this is a balance. I wish sometimes it didn't have to be a balance of competing harms. We are not complacent about the harm that COVID can do, but equally we cannot be complacent about the harm to children of missing their education, of being out of school. And over the earlier part of the summer, of course, we saw a lot of debate about full-time versus blended education. And I think while there will always be differences of opinion here, I think probably the majority opinion in Scotland was that we needed to get children back to school on a full-time basis as quickly as possible with the right mitigations in place. But this is something that we keep under review on an ongoing basis. And the most important thing, if we want to protect the ability of young people to be at school, is for all of us to do what we need to do to try to keep community transmission of this virus as low as possible. Okay.
So in relation to children and young people, there's a lot of things that we can be very confident about that the evidence tells us. There's some things which we see that there is, as I say, divided scientific opinion about. We can be really confident that actually children and young people tend to be affected much less severely than older people. We can be really confident that it's extremely unlikely that any young person would suffer a serious illness as a consequence of this. And we can be confident that younger people are less likely to transmit, young children are less likely to transmit than slightly older children. There's that gradation that the First Minister has spoken about there as well. Beyond that, there's a lot of uncertainty that still exists that we continue to keep under review at all times. And I think it's really important that we learn from both our own experience but also the experience of countries abroad as they're producing more and more evidence in relation to this. The 4 UK CMOs continue our discussion with each other in relation to the evidence that exists in this, and we will continue to update people as we come to firm conclusions as to how to apply that evidence.
Fraser Knight from Global.
Thanks, First Minister. We've had a number of teachers getting in touch to tell us that they're really struggling to do their jobs with current class sizes. I'm told, despite some senior pupils wanting to social distance, they simply can't physically, and teachers are hemmed in boxes, I'm told, at the front of classes. Now, one senior management teacher says it's not too late to bring in blended learning now, and that would be best for them. First Minister, did you bow to pressure and rush into bringing schools back full time? And is blended learning still a consideration going forward?
Did I bow to pressure? I try not to bow to pressure here. I try to take decisions that are not easy decisions, but taking account of the various considerations and try to take the best way forward, recognising that there are no ideal solutions given the nature of what we're dealing with. I think it's right that we have children as far as possible having full-time education. We know, and we've obviously had lots of different aspects to this discussion in recent weeks and recent days, in fact, the harm that's done to children not being at school. And we know that having a significant part of a child's education at home raises a whole range of other challenges and pressures as well. So I do think it is right to aim to have our children in school full time. We've always said, of course, and you will have heard me say this, blended learning, that's why the work done on blended learning was not wasted, because that is always going to have to be a contingency. If we do have outbreaks in a particular area or even in a particular school, it may be necessary to move on a limited basis to blended learning, or, and I hope with everything I've got this doesn't happen, if we see prevalence of the virus significantly increase again nationwide, then we cannot rule out a return to blended learning. But I think as far as we can keep prevalence low, then we should try to get our children having the benefits of full-time education as much as possible. All of that said, I don't underestimate for a second how difficult this is for young people themselves and for teachers right now. That's why we're investing in more teachers so that schools do have additional resources to call on, and it is why we will continue to look at different ways in which we can support frontline teachers, teach young people, but do that within the confines of the guidance that is there. So I can't stress enough, all aspects of how we're dealing with this virus we keep under literally daily review, but for reasons I think everybody will understand, that is particularly the case with schools. But we have to recognise that, yes, we know the risks of COVID, but the risks, potentially long-term and long-lasting risks to young people of being deprived of normal schooling is also significant, and we have to try to get that balance as right as we can. Brian Rutherford from Bauer.
Thank you, First Minister. The parent group 50/50 is telling Radio Clyde that they want you to publish contingency plans for supporting school kids forced to self-isolate during term times. So what are you doing to make sure that these pupils do not fall behind their peers while they are not allowed at school? And do you agree with the EIS Teaching Union, which claims that your COVID safety guidance inside schools is at odds with the rules outside of schools? The EIS wanting you to hire 3,500 extra teachers to reduce class sizes and further distance pupils from one another. Will you do it?
Let me take those on the 50/50 campaign. I've not seen those comments, so I'm going to look at those comments and come back with a more considered view if there is further guidance or contingency arrangements that would be helpful for us to set out to assist parents. We will, of course, look at that, so I'll take that one away. On the guidance, the EIS, of course, are part of the Education Recovery Group, which collectively agreed the guidance in place. That guidance, of course, will remain under review. And we looked at, particularly around physical distancing, whether, and this is where we took the scientific advice of the subgroup that I've referred to, as to whether there were particular circumstances in schools that would lead to a different position on, for example, physical distancing than outside of schools. And we set out very clearly the outcome of those discussions. On additional teachers, we have already, I referred to this in my last answer, we have made funding available to recruit, I think, more than 1,000, I think it's 1,400 additional teachers to help with the pressures in schools, and we will continue to talk to teachers, parents and young people's representatives as we go through this to make sure we are doing what is necessary. But I come back to this point here about it's a really important, we debated this long and hard publicly and in Parliament over the early part of the summer. Getting as much normality into young people's education as possible is really important, and we've got to do that safely, but the obligation on all of us to make sure we are doing all the things necessary to keep COVID under control is the most important thing we can do to keep schools open and to keep them open safely so young people can get that education. Fraser Nicholl from Original 106.
Sorry, could I just ask both of you, are either of you concerned that NHS Highland are failing to get coronavirus testing kits to some postcodes? A Caithness man has told MFR that he needed one, they were out of stock, and then his GP practice said that it couldn't be delivered to his home.
Okay, Brian, I don't know the details of that situation. If you pass those details on to us, we will look into that and again both get a response to you, but also if there is an issue there that needs to be rectified, we'll take steps with NHS Highland to rectify that. But I don't know the particular details of the situation in the locality you're talking about. Fraser Nicholl from Original 106.
Thanks, First Minister. We've been speaking to a bar owner in Aberdeen who suggested cafes and restaurants could reopen before pubs and bars as a sort of phased reopening of the city's hospitality sector because safety measures are easier to implement in these sorts of venues. Is this the sort of thing you might consider? Could we see a staggered lifting of restrictions in the city rather than them being lifted all at the same time?
Look, anything is possible. I'm not going to go further than that today because I will get advice later today or into tomorrow that will allow me and the government to take a decision about whether we are lifting any or all or none of the restrictions in Aberdeen tomorrow. And I'm not going to speculate on what that advice might say before I've got it. What I would say in general terms, which I alluded to yesterday and I think I've repeated again today, is that the situation in Aberdeen we think is improving, but the outbreak is not over yet. So it may be that we need a bit longer to get that under control. But of course, we will only have restrictions in place for as long as necessary, and for as long as restrictions are thought to be necessary, we will keep that as proportionate as possible to meet the scale of the challenge we face. But I think what I can say, probably without any real doubt, is that without the restrictions, difficult though I know they are, that have been in place in Aberdeen, we would have been dealing with a much bigger transmission episode in Aberdeen. So unfortunately, when we have these clusters, Test and Protect is vitally important to give us the intelligence and do what they do to break the chains of transmission, but sometimes we need to have more restrictions in order to get it under control.
Yeah, I mean, I think two things on Aberdeen just now. First, to say two thank yous. First of all, thank you to the local public for the way that they've entered into these restrictions and made sure that they're clamping down and preventing further chains of transmissions being established. It's really important, again, that collective responsibility we've spoken about on a number of occasions, that we're all pulling together to make sure that we take the right steps. And the second thing is a huge thank you to all the agencies who've been involved in the local response, from the clinicians, from environmental health, from all the different people who've been kind of pulling together again just to try and make sure that they're getting on top of this. It's been an incredibly complex outbreak, but there are encouraging signs coming from Grampian that this outbreak is certainly has improved quite substantially and is starting to come under control. Later today, I'll hold further discussions with members of a series of those agencies. I'll hear the latest information in terms of how they feel the wider outbreak in Grampian is coming under control. And one of the important facets of that discussion will be the opinion of the clinicians and the wider incident management team to see how we form the next steps in relation to the restrictions that are currently in place.
Thanks, Gregor. Neil Pooran from PA.
Thanks, First Minister. Regarding Professor Debbie Schroeder's article in the New York Times, which I think was mentioned at yesterday's briefing, the Welsh Health Minister, Vaughan Gething, has tweeted saying he's unhappy that Wales was, as he puts it, being lumped in with England in this article. He says that Wales was actually taking a much more cautious approach and its positivity rates compare well with the rest of the UK. I was wondering if you'd had a chance to read Professor Schroeder's article now, and if you thought the language was appropriate.
I've not had time yet to read the article, and I don't really necessarily feel the need to, because I know the point Davy is making, and it's a perfectly legitimate public health point. And I have not seen Vaughan Gething's comments either, Vaughan. Like the entire Welsh Government, we work very closely with them and very constructively. But this is not an argument that's about England or Wales or Scotland, or, you know, there will be times when, as in Aberdeen just now, we were encouraging people in Aberdeen not to travel out of Aberdeen. This is not about different countries or nationalities or different groups of people. This is about trying to keep an infectious virus under control. And when there are outbreaks in particular parts of the UK, that may mean limiting travel or advising against travel from those areas to other parts of the UK. And of course, as we know, when prevalence looks as if it's on the rise in other countries, as in recent weeks we've seen in Spain and France, it may mean imposing quarantine, because as we get prevalence down to low levels in Scotland, and this will be true of England, Wales, Northern Ireland, the bigger challenge then becomes how you stop the virus being re-imported from other places, and that will cut in different directions at different times. And I would not take, I want us to be successful in keeping the virus under control in Scotland, but if we had an outbreak as we have in Aberdeen, I would have no objection to people in other parts of the UK saying to people in Aberdeen, please don't travel, because this is just about all of us trying to keep the virus under control. It's not political, it's not nationality based, it's not country based. It's recognising that this is a virus that doesn't of its own accord respect borders, so we have to try to put fire breaks in place to stop it spreading. And I would encourage everybody to see it purely from that public health perspective and not to try to load these debates with political or constitutional arguments, which incidentally I don't think for a minute is what Vaughan will have been doing, but I have heard others try to do that, and I think it is, you know, really doing a disservice to the big challenge that we are all collectively facing. Andy Nichol from The Sun.
Good afternoon, First Minister. It does appear that you're losing the EIS, who are demanding, as you know, more action in schools. We've had these outbreaks in schools, which you say have been brought in and have not spread, but that's surely a matter of good luck and not good judgment. And when you say if virus is in a house party, everybody's exposed to it, we should have no more than 8 people from 3 households, that's almost the opposite definition of what a school is. So you must agree there's a huge danger there.
I'm sorry to be the bearer of bad news, but we are facing, we continue to face a very infectious virus, but we have to take judgments that balance the different harms that are being done. So, you know, if we were just looking at this with one of those objectives in mind right now, probably parts of the economy would not be open yet, because that poses a risk. But we know the economic damage that is done to large chunks of the economy being closed. So we have to put mitigations in place and try to open up while still keeping the virus under control. And if anything, that is even more of a consideration around schools. It is the case that the longer children are out of school, the more damage is done to their education, to their well-being, including potentially their mental well-being. And the longer that goes on, the more risk we face of that damage being longer term. So we have to try to get to a position where we can have young people back in school and have, within the guidance that's in place, as normal as possible an educational experience. That is overwhelmingly in their interests. And that's why we have taken the advice we have, we've put guidance in place, but we will keep that guidance under review. And I come back to the point that while we've got to make sure we keep the guidance that is in place for within schools under review, we all have a part to play. That the lower we drive this virus in the community, the less chances are that there are of school pupils getting it. So none of this is easy, and we continue to work as hard as we can, as closely as we can, listening as carefully as we can to different voices who have a lot of experience and expertise to offer us, and I would include the EIS in that. But we are all trying to make very difficult to balance decisions here to try to make sure that overall we are not inflicting any more harm than is necessary on the population during the pandemic that unfortunately we can't just magic away. So we will inevitably at periods during this take different judgments about different things, but it is all with that objective in mind of keeping the virus suppressed while allowing as much normal life to happen as possible. Conor Matchett from the Scotsman.
Thank you, First Minister. You've mentioned today about a couple of the new clusters being linked to social events indoors. And Eric McQueen today, the CEO of the Scots Courts and Tribunal Service, said today that complacency in abiding by the rules and regulations that you set out has become difficult for many, including judges. So it's not just people everywhere. Are you convinced, we're in well over 100 days of this pandemic, are you convinced that people are still listening to you?
Well, I mean, you probably might be better placed than me to answer that question. I hope people are listening. I don't get me wrong. I understand that as people's kids go back to school, as more people go back to work, then, I'm sure people watching the hour-long briefing every day, there are not as many doing that every single day as was the case at the start, because real life has started to intrude again, which is hopefully a good thing. I think people generally are listening, and I think people want to do the right thing, but it gets more difficult. And you mentioned judges. I know I'm standing here as First Minister, and difficult, as I keep saying, I know it is to believe. Politicians are human beings too. I know in my own life how much more difficult it gets, actually, as more normality comes back into life, to remember to do the abnormal things, like keep 2 metres apart from folk in other households, or wash your hands all the time. All of that it's tough, and perhaps was easier to remember when normal life was, as we knew it, was suspended. But as people go back to doing more normal things, it takes more of an effort to remember the things you have to do. But it is even more important to remember these things as we introduce more normality, because I've said this before, and no doubt we'll say it many times again, when we were in lockdown, so was the virus. Now that we are coming out of lockdown, so is the virus. So we have to do these things to keep it under control, and it's more important. As part of our ongoing considerations, we will consider issues of compliance and consider whether things that we have previously advised people on a voluntary guidance basis to do should instead become more mandatory. And we don't rule that out, because it is so important that we maintain high compliance with these measures, or we will see more clusters and we will see more outbreaks, and the risk is that those outbreaks sooner or later will seed and feed into wider community transmission. So it's a pain in the neck for all of us right now, but I'm afraid there's no alternative to doing this. Otherwise, we'll see this situation become more difficult again than it will otherwise have to be. Gregor, I am probably lecturing people too much. I'm going to hand over to you to try and encourage people to abide by all of this advice from a medical perspective.
So let me start by saying, in a massive understatement, that my life doesn't feel normal just now. It hasn't felt normal for months.
Don't spend so much of it with me.
Hasn't felt normal for months, and it's not going to feel normal again for a long time yet. And there's a real risk that as we get up every morning and we go about our business, that because we see the opportunity to go to the local DIY store, or to go out for a meal, or to the pub, or whatever, we treat this as things have gone back to the way it was, and it's far from that truth. We're lucky because generally across Scotland, the prevalence rates for COVID-19 have dropped hugely compared to where we were 3 months ago. And the circulating virus is at a very low prevalence, but that doesn't mean to say that it should feel normal for us at all. One of the reasons why that's so important, you only need to look around the country just now at the outbreaks that we're starting to experience as to how quickly this virus can start to get a hold again. It's a really transmissible virus. It's more transmissible than flu, for instance. It spreads really easily. It loves indoor settings, particularly indoor settings where people congregate closely together. One of the real features that we're starting to see from the learning from these outbreak management so far is that there is some common features we're seeing across a lot of the outbreaks. People are coming together in really crowded situations, indoors, and that might be in house parties, or it might be within a hospitality setting. And the social distancing that we're still recommending just isn't taking place. And of course, as soon as we get close to each other, that allows the opportunity for this virus to spread from one person to the next. And as I said, it's a really transmissible virus. It spreads really, really easily. And so it gets a grip really, really easily. And if we go back to remember all the discussion that we had about the R number in the past, and how very, very quickly it didn't take much for that R number to start to rise, and that rather than infecting just one other person, maybe we'd infect 2 other people or 3 other people, God forbid, then what we start to see is that virus starts to spread through communities really, really quickly. That's the bit that we need to guard against. And the best way of doing that is to make sure at all times we're sticking to the guidance and the measures that we've outlined, that we're making sure that where it's appropriate, we're wearing the face coverings, that we're avoiding crowded places, because we know that that's where the virus is going to spread most, that we're making sure we're cleaning our hands, cleaning surfaces around about us. Really simple, straightforward measures that we can do to be the first line of defence. And that, you know, when we are experiencing any symptoms at all, that we make sure that straight away we isolate ourselves and that we contact and we book a test, so that we can make sure that we get tested and prevent those chains of transmission from being spread any further.
Thanks. David Ball from the Herald.
Thank you, First Minister. Going back to the EIS concerns, can I just ask how you can reassure parents and pupils and teachers that a class size of up to 33 is safe in the current situation? And the EIS asked for 3,500 extra teachers to be hired. Was that decision not to do that, is it purely down to lack of funding, or are you confident that it is safe in the current situation?
We will continue to talk to the EIS about requirements that they think are necessary. We have set out previously funding to increase the numbers of teachers, and we'll certainly be happy to talk to them about, you know, the basis of the figure that they are using. How do I assure parents? Firstly, by talking to people frankly about the challenges we face and how to try to overcome these challenges. And firstly, by stressing again that nothing we're doing here we're doing lightly or in an uninformed way. The guidance that is in place for schools, we took great care and scientific advice around, but it's not set in stone. This is a virus that we are still learning about. As we get back to normal, we will see more evidence of how it transmits. And if we need to change any of that, we will. And I don't hesitate in standing up here and saying, you know, we said this last week, but this week, based on more knowledge, we may need to say something different if that is what the advice and our judgment tells us is necessary. But I suppose the other thing I need to do is ask parents and the wider community for your help. I suspect every parent right now, I'm not a parent, so I always hesitate to sort of talk about what a parent will be feeling. I'm sure every parent will be feeling huge anxiety about their child being back at school. That's understandable. But I suspect every parent also really knows how important it is for their children to be back at school and to be having education on a full-time basis. And if we want to protect that, all of us have to do all of these other things that help us to keep the virus suppressed. There are no easy answers in any of this. I so wish that there were, and I wish there were easy judgments and simple solutions to all of this. This is a hard slog for all of us, for every single person having to follow all of this advice. And it's unfortunately probably going to be a hard slog for quite some time yet to come. But increasingly, we have to focus on doing everything we can to keep the virus suppressed for its own sake, but also so that we can start to ease some of these other harms that lockdown and having children out of school are doing. So I just ask people to stick with it and remember that we will, you know, succeed or fail in all of this by the collective efforts of all of us. Derek Healy from the Courier.
Thank you, First Minister. You said earlier that the Cooper Angus cases could constitute a complex and potentially significant cluster. Could you expand a little bit on what makes you categorise it in that way? What is it that's about these cases that are especially complex? And I think the obvious concern would be whether this could lead to an Aberdeen-style local lockdown. Is that something that's a realistic prospect at this stage?
Well, again, I'm going to be very cautious about speculating. We don't rule anything out whenever we're faced with clusters. If we can't keep a cluster under control purely through test and protect, then additional measures always have to be possible, and that is not an indication one way or the other of what might happen in Cooper Angus. When I say it's likely to be a large and complex outbreak, I wasn't talking, just to be clear, about the complexity of individual cases. I was talking about the fact that this is a big workplace. There are around 900 people work in it. The nature of what it does, temperatures, it's a food processing plant, so the conditions we know, and we've seen outbreaks in many food processing plants in other parts of the UK, Anglesey, for example, as well as across Europe. So we know these are places that the virus can easily spread, and when it gets into somewhere like this, it can, spread quite widely. There are also economic impacts of it being closed for a period of time, and the animal welfare issues that I've spoken about are also in our minds. So all of these things make it a potentially complex situation, but of course, all of the steps that need to be taken are being taken or are in the process of being taken, including mobile testing capacity to, as quickly as possible, get the wider workforce tested, and we will, keep people updated on that as more information comes to light. One of the things, Gregor will have been involved in conversations about this, so I'll hand over to him, but because we've seen food processing outbreaks in other parts of the UK, we have some lessons that we can learn from how they were handled in these other parts of the UK that we can try to apply here. So that may be something you want to pick up on.
So one of the things that you will have noticed from reports around the world is that there are certain types of manufacture or plants, industrial plants that are more susceptible to outbreaks like this, and food processing plants are fairly high up in that list. We know from experience working with colleagues across the UK in particular, and how that they've handled some of these outbreaks. There are some really important considerations that need to be made. Some are those in relation to whether the plant continues to function or ceases activity, looking at some of the measures within the local community and how people within that community interact with each other, and really, really importantly, how we communicate with all those communities as well. Over the course of before the news of this particular cluster became evident, we were engaging with my CMO colleagues across the UK, and particularly with the experience in Wales, in Anglesey, to see what we could learn in preparation for the possibility of an event such as this. And our colleagues have been very generous in sharing the learning with us, and will continue to do so as we kind of start to kind of really pick apart these different steps we need to take to get in control of this particular cluster that we're seeing in Perthshire just now.
And penultimate question today is Michael Blackley from the Daily Mail.
Hello, good afternoon. You've referred to a number of instances today where primary school children are involved. Is contact tracing a bit of a challenge when it comes to such young children? And because of any potential difficulties in them saying exactly who they've ultimately been playing with for the previous week, does it mean that you need to take a pretty cautious approach to what you would do in response to that? What would, for example, the threshold be for how many pupils would need to be testing positive before you would take measures like blended learning or closing a school?
Well, these are the primary cases I've spoken about today are at this stage sort of individual cases rather than clusters, so that may change. But in where appropriate, steps will have been taken to ask classes where a child has been to self-isolate. Is it more challenging? I'll maybe hand over to Gregor probably for the sort of medical clinical perspective on that. I suppose in some ways it might be. In other ways it might not be, because children younger children in particular, will spend most of their lives under some kind of supervision. So there will be an adult that knows where the child has been. They won't necessarily be out and about on their own. So there will be aspects that are more challenging and aspects that might not be. But that's why it's so important that our contact tracing teams have the ability to use their expertise to take whatever steps are considered necessary. And in terms of overall decisions about schools, these will be very much driven by the judgment of the experts on the ground. We will be precautionary in these judgments where we need to be, because that's appropriate, and continue to try to strike that balance between protection of children, which is the most important thing, but trying to get children's education as close to normal as we possibly can.
The consultants in public health medicine, the health protection nurses, the people from the test and protect teams who are involved in this are all very, very skilled. And, you know, for any of us who've worked with children, particularly interviewing children over a number of years, you begin to learn that there's a particular knack. So, you know, there's none of this which is something which is wholly new to people in terms of how you elicit the best information from children in particular circumstances. Great care will be taken, of course, when interviewing children about any contacts that they might have. It's a very sensitive area. There'll be assistance from some of the people who may be with them, whether that be parents, whether that be school teachers, in terms of trying to get a broader picture as to what the contacts might be. And as that picture is built up, we're very fortunate these very experienced, very skilled incident management teams, staffed full of clinicians, will be able to kind of form judgments as to what the best approach in terms of reducing any risk might be to prevent any further spread.
And finally today, Mark McLaughlin from The Times.
Good afternoon, First Minister. Yesterday, you said if you were to dictate the timescales of an inquiry, journalists would accuse you of trying to curtail or direct the inquiry. So I just want to be clear that I would never criticise timely scrutiny of ministerial decisions, particularly ahead of an election, and that includes the decisions of former UK Government Minister Douglas Ross, incidentally. So with that assurance, can you confirm what a Scottish Government spokeswoman told me, that you do have the power to set a provisional deadline for inquiry and can request an interim report? And one for the Chief Medical Officer. A government spokeswoman also told me you have no data on how many people in Scotland have tested positive with no symptoms. So when you said prior to yesterday's policy shift that there was little value in asymptomatic testing, what domestic empirical data did you base that conclusion on?
I'll hand over to Gregor. I mean, I would just remind people we are dealing with a novel coronavirus here that we are learning about every day, and you know we are gathering data, but sometimes we have limited data to base these decisions on. That is in the nature of what we're dealing with. On the first part of your question, forgive me, I didn't really get your drift at the outset in your reference to Douglas Ross or anything like that, but I'll leave that to one side. The Inquiries Act 2005, I've, as a minister, established public inquiries under the Inquiries Act 2005, so I'm pretty familiar with its terms. You can ask for particular timescales and interim reports, but you have to do that in consultation with whoever you appoint as the chair. And of course, in one inquiry that I instructed, the chair and the inquiry has the ability to come back and ask for that timescale to be changed if they need more time. And I suppose the essence of that is once you establish an inquiry, you give the chair of the inquiry the independence to conduct it in whatever way. But you know, I've said openly that we will have a public inquiry into this. It's something I think is really important. But I also think it's really important, not least because of the subject matters that we've been talking about for the last hour, that I also, as First Minister, remain really focused on the real and present threat of a pandemic that is not over. And I'll continue to take decisions as best I can to balance both of those things. Gregor.
Thanks, Mark. I'm not sure I wholly understood your question either, but I'll try to answer what I thought that you asked, and that's in relation to the data for asymptomatic testing. Now, the evidence for whether to test asymptomatic people or not over the time that we've been dealing with COVID has certainly been an area which globally has been emerging, and people have had an increasing interest in. So we've been very carefully keeping abreast of the various studies which have been published across the world in relation to this. There have been some public health organisations across the globe who've been specifically looking in more detail about the place of asymptomatic testing, and their own directors of public health in Scotland have been examining the case for asymptomatic testing, looking to see exactly what would be the benefits of pursuing such an approach, but also, really importantly, whether there would be any potential complications or disbenefits from pursuing that type of approach as well. Here, the data from labs, from virologists, and the assessment that they've had playing in from our advisory group on testing in relation to the degree of false positives you would get, particularly at low population prevalence levels, becomes really important. because we know from experience and from the data that is available that at times of low prevalence, the more asymptomatic testing you do, the more likely you are to get the results which are either equivocal in terms of their reading or that may give you a misleading result as well.
Okay.
Dr. Smith, I just want to just check that. So when you test someone, and you obviously produce a report for that test, is there a box that says this person tested positive and did they have symptoms, yes or no? Do you collect the data in that way?
So those type of findings are established through the subsequent inquiries through IMTs, and we're starting to get a sense from some of the IMTs as to what proportions of people may be displaying symptoms or not through those.
So I know the information I get regularly now on identified cases will have more information than previously about whether people were pre-symptomatic or symptomatic. But of course that will be a change in picture. Somebody's test may have been, one day and they develop symptoms the next day. So the point we're making here, and I'm obviously not able to make it with Gregor's expertise, is that this is not an exact thing here. We're learning about this all of the time, and the differences between pre-symptomatic, asymptomatic and symptomatic are often not absolutely clear cut. There's also I know you enjoy reading articles about the science around this. I read one myself just the other day about the point Gregor was just making about the increased possibility of false positives or false negatives when you have low prevalence. So if I can find it, I will. I'll get the link to you, and no doubt that will spawn lots of different questions in briefings later this week. That concludes the questions for today. Thanks to everybody who's joined us. My thanks to Gregor for his assistance today, and to Anna, our BSL interpreter, and thank you to all of you for joining us. Please remember all of the facts, advice: face coverings, avoid crowded places, clean your hands and hard surfaces, 2 metre distancing, self-isolate and book a test if you have symptoms, and please help us get that message spread as widely as possible. We are in this situation right now, as you will have heard from everything we've been saying, of general low prevalence but increasing challenges of outbreaks and spikes and clusters, and we need to all redouble our efforts to try to stop them happening in the first place, but help keep them under control when they do. So thank you for all your help in doing that, and please spread the word. I will be back here tomorrow, Wednesday at 12:15. Thursday I'll be in Parliament for the 3-weekly review, but tomorrow, as part of the briefing, I'll be able to give an update on the restrictions in Aberdeen and whether or not we are changing that position there. So I will see you tomorrow.